Монголчууд чи дээр үеэс надад нөхөрлж ирсэн. Өдөр тутам хэрэгцээ тэгэл морин өдөр болгоно наалмалтай юм шүү дээ. Өвлийн захтал сайхан шүү дээ адуу нөх шанаад идэхэд. Таахгүй шүү дээ адуу нөх идэж ихж явахд бол.
The concern is that emerging diseases could cross from the animals to man and cause severe illness. Duke University is very forward-thinking in that we're partnering with people from about 80 different countries doing studies like this to improve the health of people and sometimes, in this case, animals. We know that about 70% of the time that emerging diseases that affect humans come from animals. And so where we want to study novel pathogen emergence is places like this in Mongolia, where there's a large number of animals in contact with people. So we're here trying to anticipate how the next major human pathogen threat would affect mankind. The Duke Global Health Institute is partnering with the Mongolian Ministry of Health to conduct One Health research and training to better improve the lives of people and animals and actually improve the environment here in Mongolia. We're doing that by training U.S. scholars and Mongolian scholars to work together on some of the zoonotic disease problems here in Mongolia.
Horses are very important part of Mongolian nomadic lifestyle. If horses have acorn influenza, it can be transmitted very fast one to another herder family. We look for the pathogen of the acorn influenza, which is H3N8 from the sick horses, and then we look for the viruses from humans, if it's transmittable or not.
We're bringing some technology here from a company that makes diagnostics in the United States called CUGH, and we're trying to be able to detect human influenza and equine or horse influenza in these rural regions where they don't have any diagnostics. Currently, for people in this area, which is 5 or 6 hours drive from the capital, to make a diagnosis of influenza virus in humans or animals, it may take a week. By that time, the person is either recovered or has perished. So what we're trying to do is give them a much shorter time frame, maybe half an hour, such that they could administer vaccines to the animals or people, or the families, or antivirals to the people and save lives.
This was a very big issue in the country. So after bringing this technology, new machine, so we can do the test within 20 minutes in that area, right? So doctor can get the result very quick and start with the appropriate treatment right away.
So we have the rapid influenza diagnostics at the branch of the National Center for Zoonotic Diseases to help you. Maybe you will save some lives, yeah? Mm-hmm. Save some children's lives.
Now they are ready to work on that machine, Sophia machine, a rapid test machine, which is a very new and high technology. We have never used that kind of machine before.
Mongolia is a very unique place, and they're some of the last nomadic people. But there's not a lot of attention with respect to surveillance. And so sometimes we might find something that could be a major threat to mankind in this kind of a setting.